As both a parent and professional in the autism world, I've seen a lot of echolalia in the past 2 decades. So, echolalia is a child with autism repeating what you just said. So, if you say, "Do you want a cookie?" the child can either say cookie or "Do you want a cookie?" Either way, we're talking about the child echoing you without answering your question. So today I'm going to talk all about echolalia. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author of The Verbal Behavior Approach: How to Teach Children with Autism and Related Disorders, which is now available in over 10 languages. So in my career as a behavior analyst, and even as before I was a behavior analyst, when I just had Lucas, I did have some experience with echolalia, both immediate echolalia and delayed echolalia. That's hard to say. So several months ago, I did do another video blog on delayed echolalia, which is really scripting and stimming. So I gave the example where we would take him to the park when he was young, before I knew anything about autism, before he was diagnosed, and my husband and I would read him the sign, "Please do not feed the duck, quack, quack." We would go to the next sign, we'd say the same thing, and then in the middle of the night, he'd wake up and he would start repeating, "Please do not feed the duck, quack, quack." Not that clear. But what he was doing is he was engaging in scripting, which is delayed echolalia. He was remembering what we said and he was saying it. But a bigger concern for kids with autism and for professionals that's often confusing is what to do when a child with autism, whether they're your client or their child, or your child starts repeating what you say and starts just "touch your head" or "do you want a cookie?" and he's just reciting back. Some behavior analysts even have a problem if you say "touch your head" and the child says "touch your head," or "touch the banana" and the child echoes "touch the banana." Many kids with autism, as they're completing the instruction, will echo, and I don't really treat that. That sometimes will go away on its own, but the "do you want a cookie?" and the child says "do you want a cookie?" Or I had a client once who would repeat the "say" part. So "say banana," the child would say banana. That's obviously an error, and we need to treat this echolalia to get the child to either answer yes or no, to get the child to respond with at least one word. "Do you want a cookie?" and the child says "cookie." Still technically an error, but if the child's not ready for yes, no, then that's appropriate. So I did do a video blog on yes and no, and I developed a procedure on yes and no back when I was trying to help Lucas learn this important skill, and then my other clients. I've done some case studies on yes and no. Getting back to, the child echoes, say they echo "do you want a cookie?" and they echo the whole thing, "do you want a cookie?" The first thing is we need to do an assessment, not just of that little thing. We need to do an assessment of the whole child, because what that's telling me is they don't understand the language, and they're probably not ready for you to be asking them things like that. You want to do an assessment. In my professional career, I have really found the VB map to be the assessment that I like to use for these kids, because I've been using that. I helped start field testing it back in 2006. It was published in 2008. I've been using the VB map for kids who are not conversational ever since, and I found it to be a really helpful assessment. So I would recommend a VB map, not just the milestones, but also the barriers, the transition assessment, and the echoic assessment. There's also another really important assessment subtest that was created by Dr. Mark Sundberg with the VB map, but it's not actually a part of the VB map. It's a supplement. It's called the intraverbal subtest. And you can get this available online for free. and I can link it in the blog description for you to be able to download it. It's a really helpful tool to begin to assess the child's ability to answer questions. So the child might not be able to answer what's something that you eat for breakfast, but they might be able to answer, you sleep in, what does a cow say? You know, easier questions they can answer, give the interverbal response. But when it gets to be harder, that's where they can't answer that. So doing a VB-MAP assessment, doing an interverbal subtest is great. And then making a plan, not just to get rid of the echolalia, because a lot of times the echolalia does have some benefits. Number one, we know the child can talk. And many of our kids that have this echolalia, actually their articulation isn't that bad either. So those are all good things. We just have to direct that echolalia to make it more functional and to get the child to the next level. My online courses utilize the VB-MAP, the interverbal subtest, self-care checklist, all resources from Dr. Mark Sundberg. I've also created my own assessments, and we basically step back, look at the whole picture, and help both parents and professionals figure out the next step for their own clients and children. So if you would like to learn more about how to assess the whole picture and how to use the echolalia that we do have as an advantage, as a strength, not a weakness, I would encourage you to sign up for a free online workshop at marybarbera.com/workshop. If you enjoyed this video, please leave me a comment, give me a thumbs up, and share the video with others who might benefit. And I hope to see you right here next week.